Wanted to post a brief remark on searching for a sex therapist. Now, there are really, really good therapists in Utah. And in Utah County specifically, I feel like we have a plethora of amazing therapists. However, a lot of consumers don't realize what it takes to become a sex therapist. Now, any therapist with any license can do sex therapy. So you can be a licensed clinical social worker, a marriage and family therapist, a psychiatrist could do sex therapy, an LPC could do sex therapy. So really anyone that has a therapy degree and a therapy license can do sex therapy. Sex therapy is not regulated in the state of Utah. There's only one state, Florida, in which it is regulated and you have to have a sex therapy certification for. Now, just because these therapists can do sex therapy does not mean that they are competent or trained in sex therapy. You, as the consumer, need to be aware of that. A lot of therapists will go through graduate programs and they can opt not to take a sex therapy class. So they may be amazing therapists, but have never taken a sex therapy class. Some graduate programs don't even require their students to take a sex therapy class. And so you may be meeting with a therapist that says that they're trained in sex therapy, but may have never had a class, never been to a conference, never had met with any clients that struggled with sexual intimacy, and yet they are your sex therapist. Now, to me, I see that as a really big issue because you're opening up, you're being vulnerable, you're talking about something that you maybe have only talked about with your spouse to this other trusted person, and this other trusted person probably isn't trained enough or capable enough or might not be trained to help you in doing sex therapy. So you got to be really well informed. So some questions that I would ask my therapist when I'm looking, or if I were to look for a sex therapist, would be, how often do you do sex therapy? How often do you deal with this specific issue? Your specific reason for coming to treatment. So sexual pain or issues of sexual satisfaction or erectile dysfunction. How many clients a week, how many clients a month, or how many clients a year do you get that have those types of issues? Now, myself and the therapist here at Covenant Sex Therapy, 95% of our clients are going to have some sort of sexual issue. So if you ask me how often I meet with clients that have issues of sexual pain or anorgasmia or female orgasmic disorder, for instance, I would say I get multiple clients a week that have those issues and that we're trying to work through anorgasmia or sexual pain. So it is my bread and butter. It's all that I do and all that my therapists do here at Covenant Sex Therapy. Now we get 5% probably, that's just a rough estimate, that don't have sexual issues, and they are referred by friends or family members that have come and met with us, or they found us online and liked the reviews, or they were referred in by a professor at one of the universities or another therapist in the area or somebody that knows us. And so that kind of makes up that 5%. Now we're trained in other forms of therapy. It's not like we just know how to do sex therapy, but we specialize. We are highly specialized in sex therapy, and along with that, relational therapy, because the relationship has a huge impact on the sexual relationship. So you're also looking for a therapist that has relational training if you're coming in with your spouse. A lot of programs don't require their therapist to go and do any relational training. They may not have any hours in relational therapy whatsoever. And then they hang up their figurative shingle and they say that they're relational therapists or they're sex therapists. They can do sex therapy and they can do relational therapy, and they've never had any of those clients. Or they've had a handful of those clients over the last year that they've been in practice, or the last several years they've been in practice. They've had 5 a year. Now, to me, I would not go into a therapist unless I knew that they were really well trained and really well versed in whatever the presenting problem is. And in this case, really well versed and trained with sex therapy or specific sexual dysfunction. So I think it's important that you're aware of that. The last thing that I want to mention, and it's a hang up for a lot of people, is does the therapist accept my insurance? Now that's a factor because we are all impacted by our finances. However, that is not the criterion that I would use to choose my therapist. You want to choose someone you feel comfortable with, you feel safe with, you feel like they are competent and capable, and they understand you. We call it a therapeutic alliance or a therapeutic relationship. Someone where you can have a really strong therapeutic alliance or relationship with, and someone that's really well trained in relational therapy and sex therapy if you're looking for a sex therapist. I hope that helps.